Welcome back to season 3 of School of Speech, presented by Speech Therapy PD. I'm your host, Carolyn Dolby, and I am super excited to be kicking off this season with an episode that is close to my heart professionally and personally. In today's episode, Books and Brave Bites, I am joined by one of my dearest friends and brilliant colleagues, Margaryta Kuzmin. She is here to share the why and the how of integrating food exploration and literacy to support our students with autism and pediatric feeding disorders. You are going to leave with practical school-based strategies that you can start right away, like tomorrow if you're already in school, or as soon as you are. And don't forget, you can earn 0.1 ASHA CEUs by completing the course modules on your speechtherapypd.com account. Now let's get on with the show. All right. Welcome, everybody. Oh my goodness. Hello. I am so excited. We are kicking off season 3 of School of Speech. It's presented by Speech Therapy PD. And I'm your host, Carolyn Dolby. And thank you so much for tuning in today. For today's episode, it is titled Books and Brave Bites, School-Based Food Exposure Program for Students with Autism and Pediatric Feeding Disorder. And I am overjoyed to have one of my besties back, Margaryta Kuzmin. Besides being my friend, Margaryta is an amazing, amazing clinician. She is bilingual. She's a pediatric SLP and child educator who specializes in feeding and swallowing, as well as augmentative and alternative communication. She's had over 15 years of experience and has serviced hundreds of linguistically diverse, mild to severely delayed and medically complex children from early intervention and all the way through all the school settings. Margaryta is also a known author. She has a book called Baby Zoo, and she's also contributed to various publications, as well as received and will continue to be receiving, I am sure, multiple awards throughout her career. All right, as we start settling in, I do have some housekeeping to talk about before we get on with our amazing clinician. I do want to remind everybody that each episode of School of Speech is offered for 0.1 ASHA CEUs. Next, I am going to go over our disclosures. Okay, here we go. Financial disclosures. Margaryta is employed by the New York City Department of Education District 75, Special Education. And she is also the owner of Kuzmin SLP, mentorship and trainings for SLPs. We're going to talk about that at the end of this. I wrote it down because we've got more to come. There's a lot of resources today. Non-financial, she is a member of ASHA SIG Special Interest Group 16 and 13, as well as Feeding Matters. She is a committee member on the Shannon Goldwater Summit for Change Committee. She doesn't have enough already to do. You're going to die, you guys, when you hear all the stuff she's doing. Okay, for me, I am a salaried employee of the Portland Public Schools in Oregon. I'm compensated for my graduate courses that I teach, and I receive compensation from Speech Therapy PD for hosting School of Speech. Non-financial, I am also a ASHA SIG member of 13, 16, and I feel like there was another one, but now I can't remember what I'm on. I did the school one, the feeding one, and the culturally diverse one. Okay, sorry about that. I'm a little like, oh my gosh, I'm back from a hiatus. What am I, still in summer vacation or something? All right, enough about me already. Jeez Louise. All right. Hi, Margaryta. I am so glad you're here. I am so excited for tonight. I always love collaborating with you. You have become such a great friend and support for me. We've collaborated on several projects and more to come. But today, it's all about you. I can't wait to get into this. You know, we're both lovers of feeding and swallowing, but I know that our listeners, and I'm just taking a quick peek, that for the majority there's yeses. We do have some no's, but
Yeah.
for the most part, yes, children are coming to school with feeding and swallowing issues. It's something we're dealing with.
You're going to see more of them coming
Mhm.
into something that is happening in New York City, and you guys can again let us know in a chat. We see more of kids with autism being placed in a lot of inclusion programs within the regular education, a lot of like ICT classes, and then those kids, what I hear the regular education SLPs are sharing. A lot of them come with a lot of sensory issues, not, non-speaking, a lot of issues which they haven't seen that before. So, and what that tells me, again, having these children on your caseload, we're going to have some of them, majority of them, who are having some sort of a feeding and or swallowing issues. So it's definitely going to happen. We're going to see more of them. So, and that's why I feel like this topic is so important. And I'm so glad that we have people joining us today, because I have an amazing program to share, just in case if you were thinking to do a similar program in your school.
I know. I love it. I love it. So, what's your journey with feeding? I think I've spoken about mine before, so let's hear yours. How did you get into feeding?
So in the grad school, I absolutely loved anatomy, and I aced that course. And I thought, well, this is my passion: feeding and swallowing in adults, because I didn't even think that kids
Hmm.
can have a feeding and swallowing issue. It was more
Right.
adults geared, and you only thought about stroke and then a feeding and swallowing issue, and that was the kind of like the summary of my love for that, for the feeding and swallowing. And life has turned its ways around, where I ended up being in special education in New York City Department of Education, working with children with various of complex medical needs, as well as various neurological and neurodiverse diagnoses, like such as autism. And what I start thinking about when I saw my first 7-year-old child on the bottle, I kind of start
Mm.
thinking about that, like, hey, like, is anyone out of the 9 therapists here in the school, like, have you guys done feeding? Like, do we think it's okay that he's on the bottle at 7 years old? Like, are we doing anything about it? And the answer is, we don't do feeding. That's the answer in the schools, right?
Right.
And or for example, having a child with cerebral palsy who is in super reclined position on the wheelchair, and paraprofessional is feeding that child
Yes.
in that way, like, and there's no one like teaching about gravity and how it's really, really dangerous for that child and things like that. And those are the things that I saw in my schools. So I just kind of had to give myself a job, a role. It was
Hmm.
very passion driven, I have to say. But I said, hey, like, I want to be that person then. If there's no SLP that is going to look at it and question it, I'm going to be the one. And it definitely was a rough journey in the beginning, because a lot of administration or teachers, I was newly hired, I was very new, I was very young, and the looks that I got, like, who are you, like, why are you teaching us these things? We've been feeding these kids for 20 years.
Hmm.
But slowly, because I came with a lot of love and passion, and it wasn't about criticizing them, it was about, hey, what can I bring to the table? And slowly I started to shift the way that the school was looking at feeding. We changed the spoons that the school uses. We did a lot of different things. We looked into the menu that some of those kids were getting. And slowly, I mean, like, it's definitely over a period of 5 years or so, that I built this trust within my school that I am the person to go with the feeding and swallowing questions. And now even SLPs with their caseload will come up, hey, can you come take a look at this kid? Like, I
Perfect.
think is an issue. So that's kind of like my journey. And obviously now, with having even more experience, because now I'm really getting my hands dirty into this, and I'm really trying to push for new things and push our school to do more, I obviously have a lot to share as well. And that's why I'm also doing a lot of trainings as well,
Hmm.
as you mentioned. So that's kind of like where my love and passion lies. And I'm so happy to be here to share um,
Oh,
the program.
we are the lucky ones. I do want to point out that for those listening, is unfortunately I often, and I'm kicking myself because sometimes I think we say feeding and we mean feeding and swallowing, and I'm trying to be much better at always saying feeding and swallowing, because I think a lot of times when people hear feeding, you're going to think, oh, that's just OT, like the act of getting the food to your mouth. But then we have to think about swallowing, that involves getting the food off the spoon, the fork, the finger, the straw, the cup, the plate, and that's part of swallowing. And so I liked because I'm calling myself out because I said feeding and I didn't say swallowing, but you intentionally said feeding and swallowing. And I just wanted to say thank you for that because I think that's really important
It
for
is.
us in the schools because it is something that a specialist needs to be a part of.
And also, I wanted to mention, thankfully, to places like Feeding Matters and
Yes.
organizations that bring a lot of awareness to feeding, pediatric feeding disorders, and feeding and swallowing disorders.
Yes.
Right, a lot of parents come with a lot of information right now. So again, even parents are now equipped with more information, and we really need to be there to support them and know that we're going to help them out instead of just saying I don't do feeding. So I think that's kind of like where we
Hmm.
lie, because we know by ASHA's scope of practice, it's our scope of practice to do feeding. And I know it's scary, especially when you're starting out. I know that feeling. I know that a lot of you like, hey, like I fear for my license. Liability concerns this. I'm scared that the child's going to choke in my session. It's, that those things will not happen if you take everything step by step and you
Hmm.
do everything in a safe way. But feeding can and should be in schools, and again, I'm excited to be here and to share how it can be done. And also, our beloved Emily Homer, who wrote a
Yep.
whole book about how to go about it. Actually, I used that book to push my feeding
Mhm.
agenda in my schools. It helped me out because it provided with all the laws and regulations, state-wise and also national wise, right? The IDA, the FAPE, that support us in actually going forward with that. So I think those are the tools that we need to start off with, kind of like our foundation, and then build slowly. Doesn't have to happen tomorrow where you run into your schools. Tomorrow's no schools. Is it school? Does this still school started with in your state yet?
Not yet. No, we don't start for I have another week after this week, so I've got a little more time.
Well, it
Yeah.
doesn't mean that you have to run and just like do feeding and swallowing therapy on every single kid that you have, but it's just that small little change that you do over time, and you start thinking about, hey, like, can I possibly help this child while they're in our care?
I'm
And
putting
yeah,
sorry, y'all, if you're wondering what I'm doing, I look like I might have gone off. I'm getting Emily Homer, I got her name and here's her book. I just want people to have it because really we are charged to provide feeding and swallowing support and we're not in it alone. And I know you're going to get into talking that. And I think there has been a lot of pushback on no, people, I have heard people say, no, we don't do feeding in schools. And that is such a lie. Children have to eat at school.
yeah,
They are there for 6, 7 hours, and we are charged to feed them both breakfast, lunch, and snacks. And they have to be safe. So anyway, so that's my little platform. Sorry, I'm really passionate about feeding
I
too.
know, me too. Also, because we're talking about students with autism, or autistic students, as we are
Hmm.
called,
Yeah.
right? These students are 5 times, there's been a study done that they are 5 times more likely to have a pediatric feeding disorder. So again, like we have all these studies that support us in having this foundation that we should be addressing it. But again, when we come to our schools and administration, because we're looking at this issue in a kind of like in a with the old mind, right?
Hmm.
This is where those conversations slowly need to happen with administration, and slowly pushing this in your schools if truly your children need that type of help.
100%. Because listen, when you think about we get two things.
Yeah,
One, oh, this is medical and it can only be done in the medical. And absolutely not. It's not medical. I mean, it has to be done in the schools. Or two, we're not here to do cosmetic for a picky eater. We're not talking about that. We're talking about students that have diets so limited that it is actually affecting them academically,
yeah,
socially. When we're looking at what services are needed in the schools, kids can't learn if their
yes,
basic needs aren't being
yes,
met, and
yes.
that foundation is nutrition.
Yes, and that's actually a study that I'm referencing. It's Florence et al. 2008. You can write it in the chat, and it
Mhm.
showed that diet quality and a lot of these autistic children have, like, some of our kids just like on Oreos and chips, and
Yeah.
that's their diet, and or Kool-Aid, for example, and that's their diet, morning, lunchtime, snack, and when you ask a parent, that's their diet at home. So then when you're thinking about nutritionally, so what they found in a study is that it's the diet quality is directly linked to academic performance. Kids who are not well nourished have more difficulty focusing, remembering, and learning. So now that we have this study already telling us nutrition impacts learning and thinking and concentrating, why are we not thinking that, hey, maybe they don't pay attention because they don't have enough nutrition in them. Their
Right.
diet is so limited, and then we just kind of forget to think about that. We forget to question that. So yeah.
I know. I mean, right, right. It's like unbelievable. Before
So
the end of the in-service, can you provide a resource to find what laws are regarding swallowing? Yes, actually, they're actually when you look at what Asha's
actually,
statement.
yes, yes, and that's actually Emily Homer. She has, even if you don't have the book, if you Google her name, a lot of different publications will come up, and a lot of her publication will cite the laws as well.
There, right, and there's actually went all the way to this Supreme Court,
Yeah.
Tatro versus I can't remember off the top of my head that indicated that set the standard that the only non-medical that can not be done in schools is only medical procedures that have to be done by a licensed professional like a doctor. Otherwise, if things are otherwise, everything else can be done in the schools. But there's a lot of law out there that set precedents. Some were law, some were just hearings, school districts.
Mhm.
There's a lot of law out there, but yeah, Google Emily Homer. I put her name in the chat. Will give you a lot of leverage for that. And we
It's hard
don't,
for sure. Yeah,
yeah.
it's a really
And then
good.
also take a look at ASHA, practice portal. And ASHA's really clear that students must be safe. They must be adequately nourished. They need to be able to eat efficiently in the time allotted with their friends and with their friends and social.
Yes, socially, they need to be
Hmm.
comfortable, which something that I see with some of my autistic kids who are a little bit older in the older grades. I have a kid, just quickly, I have a kid who is hiding because he has a difficulty swallowing. So, but that's something that he has learned over time. So now he's compensating for that. But he has learned that people look at him the wrong way when he's chewing. So when he's eating, he's turning away so that his peers
Oh,
won't look at him. Like that is a reason to address
yes,
it, but we
to
haven't been there
intervene.
for him, all this time, and now he's 16 hiding. It's really hard to go back and teach him other ways,
Right.
so this
Absolutely.
damage sometimes will happen to these kids if we are not addressing that. So
I like that point. The negative outcome that will happen if you don't address it
yeah,
is damaging.
yeah,
So now we have gotten on our soapboxes. Sorry, you got tag teamed by both of us about, yes, you absolutely have to do this.
yes.
Well, why don't you tell us how? We now know we have to. So now we're all nail biting, going, oh my gosh, now just one more thing. Okay, tell us how. Tell us
I'm gonna
how.
I'm gonna lay down quickly the foundation because the time is running out. I feel like we should have had 2 hours of this.
I
So
hear you. Yeah.
yes. So let's take a look at two different sections. Section one is the literacy, right? Like, what research do we have to support our kids with literacy? And when I'm saying kids right now, students, I'm talking about the autistic population right now. Adapted shared reading, multisensory manipulatives, and visual supports boost engagement and comprehension for children with autism. It have been very well cited. There's new research in 2013, 2009, something that we can use today to really base our therapy and our ideas, right? And of course, the repetition and things like that we constantly use in our therapy. So that's literacy right here. Let's take a look at feeding on this side. And we know that non pressured, sensory rich food play fosters trust, reduces anxiety, and supports gradual acceptance of food, right? So we have kind of like these studies. So my thinking was like, how can I connect them together? How can I take all these beautiful adaptations that we're already doing, but instead of using manipulatives, I want to use food as a manipulative. Can I
Hmm.
link that two together? Because then I'm targeting both things. And my administration would love that because I am academically relevant, because I'm targeting a specific, I'm reviewing a specific lesson that the class did. But instead of using chips or whatever that they're using for math, for example, those little bears, I'm going to use pieces of food. So again, it's kind of creating that safe space, non-forceful. We're not talking about eating that food. We're just talking about being comfortable around that food and having the food as a manipulative to interact with, to have fun with, to build those fun experiences. And by merging these two research-based approaches within the school curriculum, using food as both learning tool and a sensory experience, we are simultaneously targeting literacy, communication, comprehension, and feeding skills in a meaningful, academically appropriate and hands-on way. So that's kind of like the thinking behind it. So now, how did we do it? Okay, so
Mm-hmm.
first, as I already mentioned, I've been pushing and letting everybody know in my school that I have a love and passion for feeding, and I care deeply about my children who need that type of help. So I started to have these conversations with my principal, administration, about possibly doing a pilot lesson that's going to run for 8 weeks in one classroom that we chose, that we felt had the most severely selective eaters, those who are nutritionally need the support. And then we explained how we are going to push into a math class. And instead of the typical manipulatives that the math teacher would use, we are going to use food. So kind of like we're still doing academic things. We are still uh, so the way that we did it, we did like, it's a summary of everything that you did this week, and we did this. We called it Friday, Fun Friday Food Math. Okay, so that's how we started it. And so we only did math because I thought like manipulatives, like
Mm-hmm.
it's perfect. And then things that we did, and overall, obviously, it was inspired by SOF's approach, which is kind of like that systematic approach of, if the child cannot touch the food with their hands, if they're extremely nervous, we would give them a fork. So they would still put the food manipulatives on a piece of paper or whatever, wherever we have in front of them, but they don't need to touch it if they don't feel comfortable. So we want to make sure that we knew where the child is. And the way that we were able to do that is we sent a parent questionnaire before we started, letting know that this is going to be the program in the class. We wanted to make sure that we know of all possible allergies, obviously, so we're not bringing the food that the child might be allergic to, and also finding out what is the repertoire of foods that each of those kids have, what do they like and what they don't like. It's just basically a check off in dairy, meats, snacks, and it's like, and you just check off yes, yes, yes. Does he eat it, and in what form? Is it puree form? Is it pieces, and so forth? So now that we had that information, we presented that to our administration, said, can we run it? It's only 8 weeks. It's going to be very quick. It's academically relevant, but we wanted to see if this would be beneficial for our children. So some of the things, just an example to give you. For example, when they did an addition, we would cut grapes in half, and we would do addition with grapes. So we would do 2 plus 3, put them together, right? And we had children to actually use their hands to put grapes together, and then we would count. Again, we are not forcing kids to eat it. We did do what we did do at the end of the lesson, is that we as adults modeled, this is something you could do with a grape. You can kiss it, you can smell it, you can bite it. And we just let the kids do whatever they wanted. If they wanted to follow us, they followed us. If they didn't want to follow us, they could just go and throw the grape in the garbage, whatever they felt comfortable. And also at the end, we did a graph if you liked, disliked, or was okay with the grape. So we did a bar chart, which
Mm-hmm.
was very math related, right? We did a bar chart of the class, how many students liked the grape, how many students didn't like the grape, and how many students were so-so. And we took that data in. So then, and what we did, we ran the same food twice, and then we would change to a new food. We would weigh food. We would put a big tomato and see how many little tomatoes would we would need to make them even. We did time and clock, and instead of the time, to cover the time, we did like cucumbers, and then we would help them to say which one is 3 p.m., whatever was the lesson at that time. So we always would know what the lesson is, and we would be able to adapt and bring something hands-on for them to practice that math skill.
So
So
what I'm hearing, I'm sorry to jump in, but what I'm hearing is that the food itself was just a teaching tool. It was just a manipulative. It wasn't
yes,
like necessarily the goal. You weren't
no,
goaling that the children were going to eat it. You were
yes,
actually just
yes.
incorporating it rather than a just a, a math manipulative counter.
Because for these children, food is almost like traumatic.
Right.
It's very scary. So our job was initially to see if we are now going to put that pressure on them on eating it, and
Yeah.
we'll show them it's actually just for math. It's just,
Mm-hmm.
will they be more comfortable touching it? Will be they more comfortable smelling it, exploring it, have fun with it? Because obviously, if I cut up a grape, we all smell it. We all smell it. If I cut up a watermelon, we all going to smell it, right? There's a smell already in the room because we are dealing with food, right? And then we talk about it. Oh, it's a little wet or it's a little bumpy, whatever the food was for that day. So we are talking about vocabulary, we were talking about descriptive words and so forth. We measured cucumbers with a ruler, so that was the tool. The tool was how to measure with a ruler. But we would bring the little cucumbers, the big cucumbers, the really, really long cucumbers where you need two rulers to measure, right? And it was so much fun. It was fun for us to teach that. It was fun to watch the kids interact. And what we saw as the weeks went on, the kids kind of got the point like, hey, like, I know I'm not going to be forced. Even the absolutely new food would come in. And what we saw is much better engagement, participation. And we saw that more kids were willing to touch the food and to smell and to lick the food. And at the end of 8 weeks, it was only 8 weeks, one time a week, nothing crazy, just like 45 minutes in the classroom. One girl completely transferred into having cucumbers as a part of her diet, where she only used to eat Oreos and I believe like the puffs, one of those like
Mm.
bar puffs. So we were just like, wow, like, and now she eats it. So also at the end of that lesson, we would write, today your child touched, smelled cucumber. At home, you could try this. So we also let the parents know that they were doing this and at what stage, kind of like looking at the SOS type of inspired SOS type of a way. This is where your child, how comfortable your child was interacting with that food. So that's kind of like where it started, and we were so blown away of how great this program was doing that. This year, I mean, the one that's
Yeah.
passed, we decided, well, can we do anything with ELA? We did with math, but can we do something? And initially I thought it's going to be probably harder because, how do you use manipulatives? It's not like we can make characters out of it, but it ended up being even more grand. So we took HMH curriculum for our ELA, which is like a set of books. We went through all of them. We picked all the food books, which they had
Mhm.
like a whole, it was about like how plants feed me and things like that. And then we decided instead of one food, we're going to talk about the foods in the book. So we can connect the book together. We can build vocabulary. We had sight words. So for example, if there was like the word eat, so everything that is feeding related. And we went with the same type of kind of strategy on just having to interact with food. And then we did a outline of a letter for that food and cut up that food very finely, and then the kids had to basically make a letter out of those foods. So again, it has nothing to do with eating the food. It was more on how I'm going to use these manipulatives to do a literacy activity. The teacher
And
loved.
these were little guys, right? This was
So
early
yes,
into.
this is kindergarten, first grade
Oh, okay, kinder first.
for ELA,
Mhm.
because sometimes our classes are combined. And then the math I think was first grade, something like first and second, or maybe
Okay.
yeah. So they were like doing additions and things like that already. So yeah, we were just like so amazed. And I say we, it's me and my work wife, SLP. I'm dragging her into these feeding fun stuff, but we absolutely loved it. We actually got our paper got accepted into ASHA. We're going to be presented at ASHA with this program.
Yay!
Sharing videos and pictures on how everything was for this program. So in case if you are attending ASHA, please find my presentation. It's called Breakthroughs Books and Bites, something very similar to the title of this talk. Find me because I will be sharing all these beautiful videos and how we adapted each of those books and ran that program. So yeah, so that's kind of like the underlying program, which I'm very proud of, and I'm proud that that little pilot, I want to say study, but it's not a study, a little pilot program that we did was inspiring because once we showed the pictures to the administrator, once we invited them into the classroom to see what it looks like, it brought a lot of positive emotions, which allowed us to run it again in a different capacity. And I shared that with you already, but I would love to share it with other listeners. Is that with this program, the administration has filed for a grant and it was accepted. So for this year, now we have
Woo!
through money that we can spend to see if we can expand it to other classrooms, get maybe other SLPs being involved in this program. So I'm just super grateful that something very small, something that I was only passionate about, has turned into like other people being passionate about and also seeing the benefits of it as well. And
I
hopefully you guys going to be inspired as well.
Well, what I'm thinking about is when you can hit a multitude of goals at
Yeah.
the same time, and everyone and it's benefiting everybody in some level. I'm hearing a lot that you're using a lot of language.
Yeah.
So you can be hitting those language targets. You could be working. I mean, artic, you can be when you're doing the
Exactly.
letter, you could be doing the sounds. I mean, but incorporating the food is just one more added layer for our students that are struggling. How I guess maybe what are you kind of touched on one of the challenges I would say would be funding,
Yeah.
because the first thing I thought was like, my gosh, that's a lot of money. Tell me, what did
Yes.
you do?
So there are multiple challenges that we definitely encountered. Number one is that it was, like I said, passion driven.
Mm-hmm.
So the first two programs were fully run by me and my bestie SLP. So we would fund all the foods. So obviously it adds up at the end and you see like even though I absolutely love the program, but like it's coming out of my pocket.
Yeah.
So that's kind of like, let's see if it doesn't get funded in your school and you have to continuously doing it. We talked about just how do you maintain a program like this if it comes out of your pocket? It's almost unrealistic and impossible. Another challenge that we feel like that we did that we want the food to be messy, but the classroom did get overly messy sometimes with some of the recipes that we did. So that was kind of like an additional stress for the classroom, for the parents, so that we felt like maybe some of the foods we have to be careful on exactly what we're choosing because it's not, again, even though we want those experiences, sometimes it's not realistic for the setting that we work in. Also, it does take a lot of time to adapt something in your own way where now I want the letters to be this way and I want them to, it does take a lot of that extra time that nobody has with the IEPs and all the other paperwork. So I have to say that I want to encourage more SLPs doing it, but I also understand that is extremely difficult in the settings that we work with and that time needs to be put in, but it's definitely extremely rewarding and it's amazing to see what it does after you put that work. And now once those books adapted, I'm so happy because now we can just take it and run it in a different class and everything is done. So that kind of like first adaptation is hard, right? Because you make it all and you laminate and everything and you make in the plan. But once it's done, it's going to be a breeze this year. So I'm super excited. So those kind of like the challenges that I would say that were like the biggest challenges that we faced. Also, we did have support of the teacher and the paraprofessionals. So I guess that's another potential challenge as teachers not
Mhm.
being on the board with you. So obviously start with the class that is supporting, that you know the teacher, that you know that it's going to be a positive
Mhm.
program, no matter how it turns out. Those teachers who support you and believe in you. So I would say like that would be another. And then for data taking, because we wanted to see if we could actually run this as a study and have some concrete evidence, and then just the kids being out and things like that, or professionals are changing and they don't know how to record something. That was another challenge that we faced, that sometimes we cannot control for those things that happen in the school. So that was a little bit challenging as well, just kind of keep the data going. So even though we tried our best, I don't think we can use it as a for like a true study. So we might have to like redo it again. So, but we still super proud of our achievements. We going to have like quotes from the teacher and paraprofessional, and just seeing like everybody working together, including the OT who by chance came to pick up a kid during our program, and she was like, I'm going to push in because I don't want it to. And I was like, please push in. And then she's like, would you like if, and this is like, we did not plan this ahead. I'm going to be
Mhm.
very honest. It was not planned. And she's like, would you like me to push in during this time? And I would do like a little sensory break for them in the middle of like these two activities that we were doing. And I said, that would be like fabulous. And that was just such an important tool that we had. So we would do like one activity, then we would clean it up, and while we clean it up, the kids were doing the sensory, like jumping and whatever. So they got to get up and
Mhm.
kind of move around a little bit. And then they would sit down back and we would do a second activity. So that was like such a cool thing. So again, just kind of trying to reach out because it's impossible to do it on your own, truly. But if you have a team of those people who kind of got your back, get them on board with you and see if you can run it. It doesn't have to be for the whole year. You could do it for like 5 weeks, 4 weeks, do it for 4 weeks, just a month.
Yeah,
Let's
I
do it
love that. And I
slowly,
was
let's
just
give it a try and then see what happens in your classrooms.
So I was thinking of like other funding, not funding sources, but other ways of finding food, which isn't ideal because you don't have as much control. But I do know that in the district I'm in, they have the sharing table, the no thank you table. So when the kids come through and they get their hot lunch and they have to get one of everything, they have to have the two fruits and all of that. Then there was the no thank you table. I was just thinking that would be a great
That would be a
place.
great. We do not have that. We do not have that. We just we're just focusing on like, hey, can you provide the two choices, even that the child's not going to want it? Can you just like still put the tray in front? So we're still on those stages where we're just trying to get paraprofessionals to be on board.
Oh,
And
no, no, no. I was just thinking of a way of getting food for the lesson.
oh
I
yeah,
know
yeah.
that we have an
Oh yes,
abundance of
yes. We
bananas.
did use the apples from the school because a
Yep,
lot of
apples,
schools don't eat
bananas.
them. So we used absolutely. We used some of the things if it was appropriate for our class. We used apples for sure, and I believe there were not grapes. It was pears. So that's the two things, and we would cut them in slices, and we did like fractions or whatever. So it was really really cute. So I think also just even with those foods that you already have in your schools. And a part of this ELA class that we did, one of the child also had a swallowing issue. She had a really hard time chewing. She's on the puree diet,
Hmm.
on top of having autism and other diagnoses. So with her, while other kids were exploring the food and actually just playing with the food or whatever stages they were. With her, we actually practiced the chewing skill while I was there because this is a child on my caseload. I know exactly what she needs to work on. So, and it was like super appropriate time because we are interacting with food, we have the food. So, also for that as well. So, I would use like a cheesecloth because she cannot chew properly. It's like, um, non-bleach organic cheesecloth, and I would wrap the food into the cheesecloth so it's nice and safe. She's not going to choke on any of the foods if she happened to bite them off because it's going to still end up in the cheesecloth. And I would present it bilaterally and she would practice chewing. So again, just to show you how it could 100% can be done if you put your heart and thought a little bit into it. It could 100% can be done. So yeah, so we also worked on that, and it was like quick thing, like 15 seconds, chew on this side, chew on this side. I'm so happy that you practice putting anything in your mouth and practicing chewing because you are 6 years old and you are on puree. And what's going to happen to you when you're going to go to middle school? What's going to happen to you when you're going to be in high school? I was still going to be having purees, and then you're going to feel like you need to hide your food, or you hide somewhere in the corner because now people are laughing at you at high school that you are in puree. Like it's those are the things that I'm constantly thinking about for our elementary students. Like what's going to happen to them if we do not address it right now?
Exactly. We need to set them up for after school,
Yeah.
after, that transition, yeah, going
Yeah.
forward. A couple things that I wanted to come back on. is I love that you mentioned SOS, the sensory oral,
Yes.
or systematic sensory oral motor, I think. It's
Yes.
that K2MA, but you don't have to
Yes.
be go out and, I mean, that's an expensive
Yes. You don't
program.
need to be,
You don't have to be certified because there's other ways to do it. I mean, I did get certified, but it is expensive. And in schools, we don't use any type of certain therapies. I just wanted to put that out there, but we can glean from it. There's like a hierarchy. If you think about SOS breaks it down into 32 steps, but like there's actually seven, you can start with the 7 steps, like
yeah.
just looking at the food,
Yeah.
smelling the food, touching the food, interacting with it. You can make
Exactly.
your
But
own hierarchy.
that's how we got inspired on, like, the steps that
Yeah,
we want the kids to follow at some point. But again, there's no pressure on them to eat it, and I think that was the most important part, that we just wanted to use food as a fun thing for them to feel comfortable, so hopefully they can build that trust, and then later on possibly try a food or so because of their limited repertoire of foods that they have.
right. So I think I hear you saying this is not a feeding exercise. We're not doing this as we're providing feeding therapy. What
This
you're
is the
doing is
one way that
to
you
integrate food into an academic lesson that
can.
becomes relevant and for
And
all students.
yes, for all students, and also even more so for students who have
Yes.
challenging with the repertoire of the foods that they're eating and already have so many difficulties nutrition wise and having that repertoire of foods. In the majority of that, it's like fruits and vegetables. That's majority of
Right.
what's missing, right? It's mostly like carbs and chips. And you guys can comment if you have those kids who are on those crunchy foods, specific color per se, like
Mhm.
a cheese doodle, and then they kind of go into that stuff. So we have a lot of those kids in our school. So I wanted to, yeah, here you go, hot
Yeah.
Cheetos. And definitely we see that there's a big issue. And they could be, so for example, when they go to a pediatrician, because of they can still have the weight,
Right.
the pediatrician can say like there's no weight issue, but the issue is not the weight, the issue is the nourishment and nutritions that they get from the food that they're
In
eating.
fact, there is some documentation out there that states that some that children can not only so children with a very limited diet can be malnourished and be underweight, but they can also be
Oh,
overweight
yes.
because they are consuming large amounts of like a high calorie, nutritious foods that so it's really it can impact them in so many different ways.
Yeah.
I'm seeing this seems like a great way to also bridge the gap for those kids who associate the table or high chair or wherever they're eating with the pressure of eating. Exactly.
Yes.
There's
Yes.
no pressure because actually the food isn't the actual reason we're doing this.
Eating is not the activity.
No,
Eating is
it,
not the activity.
yes,
So yes,
yes.
and that's kind of like a way to still have it approved by administration, because you make it very academically relevant, but you still kind of put that spin on, hey, but the manipulatives we're going to use are going to be food, because that that's actually going to make a difference for these children. So yes, but I love that comment. Thank you so much for commenting. It is exactly the point of that.
So let's go back for a second, if that's okay, about how you got admin on board. You, or actually, what you can't don't. You got them on board because, of course, you're going to say, "I just want to do this activity for
Yeah.
8 weeks. We're just going to bring in food. I got it. I'm paying for it." They're going to be like, "Sure, do whatever, as long as you don't get it on the carpet." Right? And then, so what changed when you went back and said, "Okay, this was positive." What were your? I know it wasn't a study but
Yes. So
what
what
were the
we saw
reason?
is the fact that the kids were becoming more comfortable around the food, like you said, like looking at the food, interacting with the food, that they were like not turning away. Like when we asked them to touch it, they didn't pull their hands out, but they were more willing to participate in activity. They were more willing to share whether they liked it or not, and they understood that activity. So again, you can have that engagement paired with the food, and those are the things. And again, for some of those kids, it was a very positive experience. And I wish to see like what would happen if we would just keep on running that, right? But again, we're just talking about that. So how do you maintain that program? So we did it to the best of our abilities for that time, and we ran this one a little bit longer. But with those videos, pictures, we invited the administration to come and look at what we've done. Obviously, we did few times while
Mhm.
we know that the kids now understood the activity, and then we invited administration to watch how we ran it, and then that's it. And we just said like, this is what it was like, thank you for allowing us to do this. We just felt like it was such a good collaborative lesson. The paraprofessionals enjoyed it, the teacher enjoyed it, because we just took over completely of the classroom. The teacher was acting like a paraprofessional in our classroom, because we just completely took over, just kind of like sit and just help a child if needed. And so that was good for the teacher. But again, it has to be like those relationships needs to be there before that. So I understand the limitations of doing that in every possible school or every possible classroom, but it's just kind of like that whole thinking. If you just start thinking and questioning a little bit and just pushing those little boundaries slightly, you may get there, and you may be able to do something similar. Maybe not exactly the same thing, but something similar. And I would be just like so happy for those kids, and so happy for you that you are pushing those boundaries, because we should have these things. We should have these exposures. These kids are going to grow up, and they're going to be a part of our society. And sometimes I think about that very often, like, what is that going to look like for them?
Yeah, another listener indicated she says, I find that teachers and parents are often frustrated and not educated, and that they'll state things like, ugh, mom just lets him eat three things, and she's never sends anything healthy.
Yeah.
And that breaks my heart. And I hear that all the time too, because I do just feeding and swallowing in the schools. That's all I do all day, every day for PPS. And so I hear that a lot, like, oh, I can't believe this mom just sends this. That might be the only safe food that child
Yeah.
eats
Yeah.
at school. Hopefully
Yeah.
they eat others, but a lot of times, they are so desperate for getting them to eat. And I know that this is just the tip of the iceberg of
Yes.
everything. This is just the tip of the iceberg, because we don't even have time to go into the medical issues, that what's going on in the child's body and all of that. And so we're not really focused. What I'm hearing is you're not focused on they have to eat this. It's just
No.
exposure to new foods and interacting. I know that there's some numbers out there that it takes 20 exposures for a novel food to become part of your inventory. And parents often stop after maybe 3 exposures, because it's expensive. Food's expensive, and to be
100%.
constantly,
Yeah.
you know
And we do have kids. We have a child who is only eating chicken nuggets from Burger King, and mom
uh,
buys them every single day. Chicken nuggets for work, but that is his repertoire. So
yeah.
when you take that away, for example, that we took all the nutrition now. So we cannot really question. It's not about mom. Sometimes it's about the child's sensitive, like the way that they perceive the world, the way that they feel like this is my safe food. Whatever was the cause of that, potentially could have been a little bit of parents, potentially could have been just the diagnosis and the things that they experience. We actually don't know. But also I understand that parents are extremely busy. And like you said, those exposure may not happen, even if you tell them, hey, like, can you put an apple? Sometimes they'll think about, maybe they'll do it one time, but it's like life goes on, and it's so fast. So having it during the school is just so amazing, because we do have that time. If we plan ahead, we can have those 20 exposures for that kid. We can have paraprofessionals and train them slowly, kindly, because we definitely don't want to come as like, hey, now today you're going to be doing feeding because I watched this course, I listened to the scores, and now because we have to be super kind and non-judgmental when we come into this space, and telling people to do things a little bit differently, people get a little bit offended. So coming from a loving way and just like showing first, like, what is it going to look like, how do you make it this way, and then hopefully you'll have people just jumping on board, like that OT that just saw us, and she just wanted to be a part of it because she just saw like how positive it is. we didn't ask her to be, but she wanted it to be. And you're going to have those people who just want to be a part of this amazing thing that you're doing. So, but I understand that some teachers and paraprofessionals will not be on board and are going to think this is more work for them. And I understand that as well.
Right. So it might not work for everyone. But
Yeah.
what I'm also hearing is it's not necessarily you're targeting ARFID or pediatric feeding disorder. You're actually just targeting exposure to healthier foods. Full
I mean,
stop, maybe?
it can be. I mean, if you think about it, the therapy approaches, if we're talking about SO as inspired, right? If
Yeah.
we're talking about just exposures, like you said, if we're talking about that study that you need 20 exposures, we're doing that. We're exposing them in academic way. So it's
Mm-hmm.
the school curriculum, but it's exposures. It's a type of therapy, but we just kind of putting a different spin on it. Instead of just sitting in my speech room and just like, hey, touch apple, touch apple, touch apple, I'm saying, hey, put an apple on an A, put an
Mm-hmm.
apple with the word apple, put an apple, what, so it's kind of like has a meaning now. Why am I holding this apple and why am I putting it anywhere? Because
Right,
there's
they and without the fear of, like, at the end, you're gonna eat it. Not at
that,
all. You're actually just it what I think I love the most about this is these are truly just a strategy or a tool. It's not the
yes,
actual goal.
yeah.
I mean, it can be no, I mean,
It
ultimately,
is the
that
goal
it
for
is
them
a
to be
goal.
more comfortable and hopefully at some point to be able, and we definitely saw like a kid who used a fork for foods was able to now move it with his hand. And to me, that was such a big progress because even touching the food was a big deal for him. And we were able to make sure that he feels safe, just like interacting with it and touching it. And to me, that was such a great progress. I was just so proud of him because he felt like he can do it because I'm not going to shove that food into his mouth. Like he could just touch it and explore it in his own way. So yeah, so that's our program, and hopefully now that we got a little bit of funding, I'm already thinking about what's going to be the new thing that we're doing this year. But potentially we're going to do the same thing. I think I really love the ELA part of it and teaching literacy skills with the food. I just want to see if we could put it in more classrooms and see how it's going to run. So I'm super excited about. And don't be scared, guys. Sometimes when you just put that first step forward and you come with that passion and tools, people start to respond because sometimes you feel like you don't have that power to be in a leading role, but you can. You absolutely can if you have the research behind you, which you
Mhm.
do. We shared so many of research. You have the laws behind you, and you have the whole point of it. Like, why are we doing this, and why is it important for these kids, right? Like the whole idea of it. So
Yeah, we have a couple questions if that's okay.
yeah,
And I've got some other things I want to ask you about too. So
yeah.
just settle in, everyone. One of it was, do you write goals specifically for the feeding portion of this or the eating portion of this?
So
Following?
specifically for this program, all we did was just notify parents and also took a repertoire of the foods that they're eating. There were no specific goals. The goals were the literacy goals, if that makes sense.
Yes, it
So
does. That's
now
what I was hoping to
we
hear.
do have kids, so that in case if you're wondering if there are kids in our schools who have feeding goals, absolutely,
Mhm.
because I work in that school. So absolutely, kids have feeding goals. Those goals are usually pertain to those very individual cases where the food is there's a safety concern with the food. If there is something like social emotional component, like the child is unable to chew but they're 6 years old, the child is on the bottle, even our tube fed children that we have, I'm always wondering like, can we do anything about it, or do we, sometimes like, oh, the child is tube fed so they're all good. Well, not really, because you know what, the body is changing, the child is still growing, potentially we may have some food trials, some. So I want to think about that and I want to know where the child is. So we do have children with the feeding goals, and I'm always happy to write them if the parent is on board and I'm on board, if everything makes sense that it's needed for the school time that they're in, if it makes sense and if it's appropriate for an academically relevant in this portion in
Right. If
this.
it's providing faith for that student. Not all, I mean, all students, as we know, all
Yes.
students would benefit from speech. All students would benefit from expanding their diet, and that's not what we're here for.
Yeah.
That program can actually expand diets, but that's not the purpose of it. I love that. We
Yeah.
also had we've got somebody that was a parent of the child's an adult now, but however, when they were in school, was sending foods that she knew that he would eat, and that's a lot of. And I think we forget that we really that parents are reluctant to send non-preferred foods because it could mean their child is going to be just like Colleen said, hungry and less attentive, and now they're not accessing their school, so that's a detriment. So we want them to be having
Yeah.
their preferred foods, their safe foods.
Yeah.
um, Nadia, thank you so much. She's working now with a student that's going to be turning 3 and going into schools.
Right.
Right, really limited, drinking milk from a bottle, doesn't eat snacks, no official diagnosis. Oh man, doctor has refused to refer to client for feeding therapy. Oh wow. She's tried some sensory exploration with minimal success. Parents say that even at home, when the child watches anybody else eat, he'll gag and walk away and never
Yeah.
want to. Do you have any insight for her?
Well, that's exactly where you would start, just looking at the child. Like, you could just do a regular speech activity and just munch something while you're doing it. That's already going to be a therapeutic thing for him, because obviously if he's just watching you eat and he's gagging, so see like if the distance makes a difference. If you eat right in front of him, will he gag? If I go a little bit further, will he gag? If I go a little bit further, and see where that threshold is, and if it does exist. Can it be on your desk? Can it be on the shelf? Is he okay just having it on the shelf, knowing that it's there? So that's the things I would trial with him. But that's really good that you are thinking about that.
Yeah, I love that. Yeah. I love the fact that you could be doing a really, I love what you said. Nadia's going to try it, doing a real preferred activity, but then you're eating. And so almost like
No
they're
pressure.
mapping,
For
no
you,
pressure, but they're mapping a
for
feeling of
you.
good with
Yeah,
also seeing somebody eat. Like it's
yeah,
putting together, it's not just sitting there having to watch somebody eat. That
yeah,
can
yeah,
gross a lot of people out.
sure.
But you're
Yes,
actually pairing it with something positive. He's doing something he likes, plus he's then
yes,
getting exposed. And maybe you need to step back and be purposeful of what you're eating. Maybe not tuna fish,
yeah,
right?
yeah,
Maybe something like a carrot or something. Or actually, cucumber is another good one,
yeah. A
right?
cucumber, something that is light, like an apple and things like that. Something that potentially have a little smell, but not overwhelming, because obviously, and you want to test that out. Do you mind if I'll share? Since
Oh,
we're
I was
on
just
the
about to say, I need you to share everything we were talking about. Go.
Thank you. So first of all, guys, for those who are listening, watching, please follow me on Kuzmin SLP on Instagram. I Every Monday I try to post a pediatric feeding disorder something, whether it's a tip, some resources. So please make sure that you're following me. I will run a pediatric feeding assessment on November 16th, which is going to be kind of like a confidence starting course. It's going to be 3 hours, and we're going to dive deep into the feeding milestones, what you should expect, what should a child do at a certain age, and then what happens after that. It's more geared towards early intervention. However, we do see some of these milestones not being met in our schools. Like you just mentioned, a 3-year-old who's potentially going to a pre-K program and on the bottle, for example. So what do we do in that case? So we are going to talk about assessment, how we assess those kids, what we need to look for, what kind of questions do we ask mom, what kind of medical things we need to look into to really understand what is happening with a child and how it potentially can impact their feeding when they're in school. And then also those kids who are in school, having those tools and assessments that are available for you to kind of give it a little bit of like, where are they truly need help? Is it more nutrition? Is it more
Where
um,
where can we find that? How do we
yes.
find you? What do we
So
get?
it's
Where do we go?
Kuzmin, which is my last name, Kuzmin, Kuzmin, SLP.com.
SLP all capital
Yep.
.com.
It's one
So
word, Kuzmin, SLP.com.
I just put it in the chat. Tell me if that's what it is.
Kuzmin with an I. I'm sorry. I know everybody's a Kuzman.
Oh,
Um,
I did
I
Kuzman
know.
with an I first, and then I don't know what happened there.
Yes,
Hold
it's
on, let me do it
Kuzmin with an
again.
I. Kuzmin,
Kuzman with an
SLP.
I, and SLP is capitalized.
Yep. It doesn't matter because it's like a link, so Kuzmin can be.
Okay, but I got
Thank you.
it.
Perfect.
Are
Thank
there
you.
any handouts for this lesson? Not for today, but
Yes.
you're going to be presenting at ASHA. Will you have
Yes.
handouts at your
Yeah, you
ASHA?
need a whole PowerPoint with all the research that we discussed today, and obviously a lot of pictures and videos. Unfortunately, they're not going to be on the PowerPoint that we are sharing with everyone. But if you do attend to the ASHA presentation, you are going to see it. It's very colorful. It's amazing, and I'm so happy to like share that part as well. Unfortunately, here like I wasn't
Yeah.
able to share it, but that's okay. I hope I'll be back on your podcast.
You
Let's
will absolutely be back on my podcast, and I'm just thinking if maybe well, yeah, no, yes, I want you back because I'd like to like maybe do one that you're like going through an entire lesson and we could
Yeah,
have, yeah, that'd be super
yeah,
fun. I
for sure.
love
And maybe
it.
bring some case studies as well. I have so many of them. Just school feeding case studies. I think that would be like a great podcast that we could do.
I
I
think
am
so.
so happy that we had this opportunity to talk about this amazing topic. I appreciate you having me here.
Oh my gosh, no, thank you. I mean, I absolutely love, of course, this is the so close to my heart because this is what I do all day, every day. I'm saying that maybe you and I should get together and maybe do another like course for speech therapy PD. And we could come together and we could do, we've come together before and we've done case studies
Yes,
across the state, across the
yes.
country. We could do that, but we could also, yeah, but I also want you back on the show because you are amazing.
Thank you. Thank you,
Like
guys.
everything, like we didn't even hit, you didn't, I mean, I know you just touched the tip of the
I tried to
iceberg.
really pack
I
this
know you
into one
did.
hour, but I could talk about this forever. And there's just so many components. Like you said, we have kids with medical needs. We have kids who nutritionally need the help. We have kids who psychosocial, which is like a different, completely different. And I have so many cases that I could share with just the psychosocial component.
Yeah.
How sometimes like our kids who eat 1 hour versus the 30 minutes that is allotted. So there's just like all these things that we could definitely talk about and see how potentially we can help them out. But yes, but I'm still happy that at least this 1 hour we were able to dedicate and maybe inspire some SLPs to tackle on this feeding journey with us.
There's one more thing I want you to share. We talked about this, but we didn't say it. You have your Mealtime Mondays on your
In my
Instagram.
Instagram, yes, every Monday I try to post whether some sort of informational thing about a pediatric feeding disorder, or sometimes I do like a trick on how to do feeding for a specific thing. So, and I try to religiously, I call it Margarita's Mealtime Monday, and I try to post something to again inspire more SLPs to not be afraid of feeding and to have the tools to start thinking and kind of like exploring feeding and feeding therapy and feeding and swallowing therapy.
I love it. Thank you so much. I can't
Thank
believe,
you.
I know we're gonna have to say goodbye.
Yes.
But I do want to just thank you, thank you, thank you. And I can't wait for you to come back on again. Thank you, those that are listening out there on YouTube or on another platform later. Thank you so much. And be sure to like this podcast. I sure do. Anyway, so we are going to have to say goodbye. I hate this, but thanks everyone for joining in. Thanks everybody in the audience. Super interactive, and I love it. So I hope to see everybody at the next episode. All right, bye
Bye. Thank
guys.
you.
Bye. Thanks, Margarita.